Good afternoon, everyone, and thank you for joining us today. I'm Elizabeth Gray from the MSDH Office of Communications. Joining us today is State Health Officer Dr. Dan Edney, State Epidemiologist Dr. Paul Byers, Senior Deputy Mr. Jim Craig, and Director of Preventive Health and Health Equity Dr. Victor Sutton. Thank y'all for being here today. Let's start with an overall update of where we are with COVID and flu activity in the state as we head into the holidays. Dr. Byers, can you start with that?
I sure can. Thank y'all. And thanks for joining us this afternoon. We just wanted to get together to give you some insight on what we're seeing with flu and COVID now in the state. You know, for a number of weeks now, we have seen decreased numbers of COVID with both cases and deaths and hospitalizations. And we've been pleased to see that. But this is a reminder that COVID has not gone away from us yet. We are starting to see some increases in the number of overall cases of COVID that are being reported on a weekly basis. We have started to see some increased hospital admissions and very little increase in ventilator use and ICU admissions for COVID-19 infection. And, you know, we've started to see increases in the number of nursing home and other long-term care facility outbreaks due to COVID-19 as well. And this is not completely unexpected. You know, we knew that as we got into the winter months, that there certainly was a possibility that we were going to see increased COVID. But you also know that we have had an early start to our influenza season this year. The activity has been increasing now for a number of weeks. We're still seeing very high flu activity in the state. And really, we're starting to see that throughout the United States now. And although flu elevated activity is not unexpected, when you couple that with what we're beginning to see with COVID-19, certainly that can lead to increased illnesses, increased severe disease, hospitalizations, and unfortunately, increased deaths. And as we get into the holidays now, it's important for us as we come together as family and friends to make sure that we are all protected against infection and those severe outcomes that can occur with both of those diseases. So for a number of weeks now, the updated bivalent booster for COVID-19 has been available. This is a very important booster vaccine to provide protection not only against infection, but protection from those hospitalizations and protection from death. It is extremely important for us now, especially the most vulnerable people in our population, to make sure that everyone who is eligible is up to date with the bivalent booster vaccine. This is a vaccine that is formulated to provide additional protection from the current strains that are of COVID-19 that are circulating and causing illness. And so the eligibility for this bivalent vaccine is if you've been fully vaccinated and it's been at least 2 months since your last shot. It's important to think of this vaccine very similarly to the way that we think of a vaccine that we get for flu every year. Many people in the state have been fully vaccinated against COVID, and that's important. But a vaccine that you got months and months or even a year ago is not going to necessarily provide you with the adequate protection you need. So it's important now to get that bivalent booster if you're eligible. Additionally, get the flu vaccine. We know that we have to get it every year in order to protect us from infection, hospitalizations, and death. When we think about who is most vulnerable in our population for both of these infections, it's especially important for people 50 and older, even more so for those individuals 65 and older. When we look at the proportion of deaths due to COVID in Mississippi, more than 70% of our deaths have occurred in individuals 65 and older. And when we look at the vaccination status for those individuals, more than 60% have occurred among individuals who have been fully vaccinated and eligible for a booster, but never got it or were never vaccinated in the first place. So really the message is, get your flu vaccine if you haven't done it. If you're eligible for the bivalent booster vaccine, please get it now. If you've never started the COVID vaccine, now's a great opportunity. These vaccines are available at county health departments. That's really all I wanted to say this afternoon, Elizabeth, but thank y'all for the opportunity.
Thank you for that, Dr. Byers. Dr. Sutton, would you like to share some insight into the continued health equity efforts surrounding the COVID response?
Sure, and I want to thank everybody for being here as well. We have a unique opportunity to engage the community. And so with that being said, we're looking for partners. The success of this effort is based on the relationships and the partners that we have in the community. And so we're reaching out to work with faith-based organizations, community-based organizations, barbershops, beauty shops, whoever that we can partner with to get the bivalent booster shot to the community. What's unique about the partnership that we have with the health department is that if you call us and you contact us, we can go into any specific community around the state and provide this booster shot. And so that's one of the ways that has been successful past history with our state and the relationships. And that relationship and those opportunities are only as strong as the folks that in those various communities. We know that the groups that's around the state in various communities know their community much better than we can ever know those communities at that level. So reach out to us. We have a 800 number that we're going to put into the chat, and we also have an email. And if we can get folks who want to partner, reach out to us. We are still in the business of providing PPE. We still can provide home tests as it relates to COVID, and more importantly, we can also help get shots in arms to Dr. Byers' point, to our most vulnerable populations and anyone who's eligible. And so reaching out to us, we can make that connection, and we can bring the shot to the community and every community around the state. And it's needed now.
Thank you, Dr. Sutton. Dr. Edney, can we turn it over to you for an update on hospitalizations and ICU capacity?
Yes, Elizabeth, thank you. And thank you everybody for joining us and to help us amplify the message to keep the public safe from a combination of influenza and COVID outbreaks. And really, I want to thank our team. Dr. Byers and our communicable disease team do an outstanding job surveilling the current situation, keeping us up to date on what we're seeing on a day-to-day basis, and especially helping us keep watch on what variants may be arising and how well our current vaccines are doing. And I'll let you know, my wife and I both are fully vaccinated with our flu shots. As a physician, I've had flu shots since I was in medical school 100 years ago. And we are fully up to date with our COVID vaccines, including our bivalent vaccine. What's gotten my attention is there seems to be some confusion about the boosters, and a lot of folks think that they're fully vaccinated from COVID, even though their booster was a long time ago. And as these new variants come and we're able to adjust the vaccine, we do encourage you to stay up to date as we're doing. As a 61-year-old Mississippian, I'm healthy, but I want to stay that way. So I'm staying up to date with my COVID boosters, as is my family. Dr. Sutton, I was concerned as we watched our vaccination rates. Our minority populations were showing the highest rate of vaccination for quite a while, but the rate of boosting has gone down severely and has actually gone below the majority population. And as I've talked to friends in the minority community, I think that it's related to confusion, not realizing that they need the bivalent booster. So as Dr. Byers and Dr. Sutton have said, if you're in a higher risk group, you really need to be vaccinated for flu and for COVID with the new vaccines. And thankfully they're working. We're getting good coverage from flu and from our current variants with COVID. And the main question I'm asked is, well, how long we're going to have to keep doing this? And we just don't know. But that's why we have Dr. Byers and his team with their expertise monitoring the situation and giving us expert advice. I'm very grateful for the good work that y'all do. Thank you. So what really got my attention and why I thought we really needed to go ahead and have the press conference today is watching what's going on with our hospitals and mainly our ICU capacity statewide. And if y'all can put the slide up to, let's show everybody what we're looking at. You know, we monitor day to day where hospital admissions are and specifically look at our ICU capacity. And on the left, the graph is showing the ICU capacity statewide, and on the right is the ICU capacity for our larger referral hospitals. And if you see, if you go back in time, you can see where our previous spikes were in the winter times the last 2 years, and that's where you see the big drop and the number of ICU beds available. And what I'm watching is currently statewide at the last snapshot we took, we were down to 65 ICU beds statewide, which is moving in the direction of what we were seeing in the last 2 winters. And then in our level 1 and level 2 hospitals, our larger referral hospitals, we were down to 27. And those are 27 beds for us to use for everything. That includes trauma, stroke, heart attacks, not just flu and COVID. So we want to protect those beds as best we can. I just met with the Rural Hospital Association, and they're struggling with being able to transfer to a higher level of care because of this. And we've been having a lot of transfers having to go out of state because of difficulty with capacity. So where you can help us is to protect yourself from getting flu or COVID by being vaccinated, as Dr. Byers is recommending, and make sure that you're boosted appropriately with COVID. And then just take simple precautions that we've been doing the last 2 winters of washing our hands. And if you're in a high-risk situation with people you don't know who are sneezing and coughing, just a reminder as a doctor who's practiced a long time, masks do work. So it's a simple tool that you can use to protect yourselves. There are no mandates. There won't be any mandates, but there are times when just common sense needs to prevail. And so protect yourself by hand washing, distancing as you can, masking as appropriate, but most importantly, having your vaccination status up to date. And let's stay healthy and stay out of the hospital so that those who are having a tragic need for ICU beds will have those. Jim, anything you want to comment on?
Just a reminder, and we'll hope that everyone goes through the holiday season without the flu or without COVID. But if you are symptomatic for COVID and you're looking for a test, please remember that all the county health departments in the state have free home tests available for you.
Thank you both for that. If y'all are ready, I think we'll start with some questions from the chat. Let's start with Garner Montgomery from WTVA. What extra precautions should parents with small children in daycare school take during the winter season?
So that's a great question, and several things come to mind. Certainly make sure that your children, if they're eligible, are up to date for both flu vaccines and for COVID vaccines. The flu vaccine is recommended for anyone 6 months of age and older. And, we do have a COVID vaccine now that can be utilized for children less than 5 years of age. Both the Pfizer and the Moderna vaccine are for those individuals in those eligible age groups. And if you saw the news today, the FDA has just cleared the way for bivalent dosing in that younger age group as well. But it's important to make sure your kids are up to date with their appropriate vaccinations. Make sure that if your children are sick, that you keep them at home. Certainly don't send your children to school if they're ill. One of the things that we've also done is work closely with schools and daycares to provide them with recommendations that they can utilize to help prevent the transmission of both COVID and flu and other respiratory illnesses that are currently being transmitted. And I think it's important to understand that it's not just COVID and flu. that's out there. You know, we have previously seen some increases in RSV and other respiratory viruses as well. So it's important to take those precautions, wash your children's hands, help them learn to cover their sneezes and their coughs. And like I said, certainly keep them home from school. Don't send your children to school ill. That's just one of the most key components.
And Dr. Byers, I emphasize that for all of us. You know, if you're coughing and sneezing, you're not feeling well, don't go to church. You know, if you're running fever, please don't go to work. It may not be that it's hitting you that hard, but you could easily expose a high-risk person that might wind up in the hospital in the ICU just because we weren't being considerate of being out in the public when we're in an infectious state. So let's just look out for each other. And if you're sick, just please stay home and take care of yourself. The
same with family gatherings this Christmas.
That's right.
Don't go to your mama's house sick. Stay home and keep everybody else well.
Brandon, I apologize, I missed your question. With the uptick in both flu and COVID cases, how should schools handle the situation, especially coming back from holiday break?
Right, and you know, we've worked with schools now, and it's hard to believe, but we've been dealing with COVID now for almost 3 years, and we're coming up on that anniversary soon. But we've been working with schools closely throughout those months and years to provide them with guidance, but also the ability to provide testing of their students and faculty. And the testing is one of the great ways, especially when you come back from a break, to make sure that the folks who are coming back after being with their family, after being off, are not bringing COVID back into the school setting. And so we still have that available for schools. We've worked with schools throughout this time, and they know how to get those tests available for them, as well as doing the other things that we've talked about, is promoting vaccination and making sure that folks are covering their sneezes and coughs, and help those kids in the school wash their hands.
We have a question from Kobe Vance at MPB. What does this rise in hospitalizations mean for hospitals, especially those across the state that have reported sustained financial strain?
Well, it's yet another problem that all of our hospitals are having to deal with, and specifically our rural hospitals are under significant strain, mainly because of inability to transfer easily, which is how, you know, our healthcare system is made to work, is to get the person the right level of care based on their needs. The hospitals currently are still severely understaffed, and these are all direct results from COVID that have not gone away. And the hospitals have had a substantial financial hit by the last 2 years of managing COVID, and a lot of their reserves and resources have been either depleted or significantly reduced. We're seeing plenty of capacity right now in our rural hospitals. It's the inability to transfer to our higher level of care. And it's our level 1 and level 2 hospitals that really are kind of being swamped right now. I've talked to administrators from every section of the state, and right now the majority of their transfers have been having to go out of state to the state surrounding us. And then Mr. Craig just notified me that Tennessee, Alabama has stopped taking referrals from Mississippi. So this is just a situation where we need to help our hospitals. We've done it the last 2 years. This is nothing new. Staffing is a big component of it this go round, but it's still the number of beds available or what we have to work with. So we appreciate your help in protecting our hospitals.
And it's not just in Mississippi, you know, Alabama and Tennessee and some of the other states are looking to transfer some of their patients to Mississippi. So it's larger than just the state of Mississippi, but it's so important that take good care of yourselves so that you don't need some of these ICU spaces and other hospital resources right now.
Along those same lines, Kate Royals with Mississippi Today is asking, do you have a sense of how many transfers out of state have resulted from hospitals here in Mississippi being at capacity?
We really don't. You know, the healthcare system in our state is a very dynamic process, and getting a snapshot in time is just that, a snapshot in time. But the report that I got around noon today was that many of the transfers that had been booked this morning were still waiting for placement. So it's just a good indicator the system is still very tight.
Another question from Kate. She says, are there any plans to increase hours and services at county health departments that have had their hours and or services cut? Would the budget allow for that?
Well, the budget will not allow for it, but we do what we have to do in public health anyway. Our county health departments, I tell folks, are a jewel in the crown of Mississippi. They're a wonderful resource. Unfortunately, they're horribly underfunded. So one thing we're looking at very acutely is, especially in the Mississippi Delta, where we're seeing significant healthcare deserts blooming, where there is nobody in certain counties except the county health department. We're looking to divert resources in those areas as much as we can to make sure that counties have access to at least basic services. And then we're working with our FQHC partners to expand access in those areas. And then again, today, working with our rural hospitals today, just working our partnerships as best we can to try to help access to care as best we can. But I just have people just need to understand things have been getting worse, not better, most recently, as our hospitals are under significant strain. And we're looking at severe access issues in the Mississippi Delta. These are all high on my priority list, and we're trying to leverage all the resources that we can to those areas, but specifically working with community partners and other partnerships to try to plug gaps as best we can.
And just to add, as it relates to COVID, we are going to scale up our efforts in the community, and we are looking for those partners. As Dr. Edney mentioned, we are seeing an uptick. We have celebrated vaccinations, COVID vaccinations in the past. And we're seeing those numbers, especially in vulnerable populations and minority populations. We are seeing that uptick, and so we're going to expand those efforts. Around the height of COVID, you couldn't see a commercial, or you didn't turn on the TV or on the radio without hearing information and where to go and those kind of things. And so we're going to have to, with your help, scale these things back up to scale, because we are seeing those numbers, and we don't want this to exponentially grow.
You. A question from Desmond Matthews at WCBI. Masks won't be mandated anymore, but what type of medicines and or vitamins are encouraged as we see temperatures going up and down? Anything we can recommend?
Vaccine is the key to the prevention of flu and COVID and its severe complications.
We do have therapeutics available for our current variants. And Paxlovid probably is the best one we have. Our monoclonal antibody supply that we have relied on the last 2 years is really in tight supply still. So we're really relying on the oral medication Paxlovid, which is widely available. And actually you can get through pharmacies under a public health order if you're unable to get a prescription and you're COVID positive. But we recommend definitely you work through your physician and provider to get medications as you need it. But if you're running fever, please get tested. Know what we're up against. If you have flu, we can treat the flu. If you have COVID, we can treat COVID. And if you have flu or COVID, we need to protect others from getting it. So we need to know what you have so we can take care of you.
Got Courtney Ann Jackson with WLBT. She's got 2 questions, so I'll just start with the first. We celebrated the successes with COVID vaccination numbers as they climbed, but are we to some degree back at square one given the waning antibodies from either shots or vaccination?
I don't know that we're back completely at square one. Certainly we have a large proportion of the population that has had some level of immunity, either through natural immunity from infection or from the immunities that they've had from previous vaccinations. But you're right that immunity can wane and can leave us vulnerable. And like I said, fully vaccinated 12 months ago, that's great and that's helpful. But we have opportunities now to get the bivalent booster. And that's what's going to provide us the most protection now. If it's been two months or more since your last dose, what you need to do is you need to get the updated vaccine. When we look at our vaccination numbers for individuals 65 and older, the most vulnerable population in Mississippi, only about 15% of that population have received the updated booster so far. We got to do better. That's going to be the way that we protect ourselves.
You know, and really what this is all about, we're trying to get ready for what we know is coming this winter.
Yeah.
We know what the last 2 winters have been like. We're just trying to be ready. So, you know, Dr. Myers, the way I looked at it for my wife and myself was, you know, we get our cars and our homes ready for the winter time. And so we just got our bodies and our immune systems ready for the winter time to be able to protect ourselves from flu and COVID, from the worst outcomes that can come with those. So the reason we're really talking today is we are moving into the wintertime surge. And we just want everybody to understand where we are, what the snapshot looks like for the state, the struggles that our hospitals have, the difficulty with moving to higher levels of care that we're having right now, and just do what you can to protect yourselves and your families so that you don't wind up in the healthcare system when it's under stress.
There have been on and off comments about a 90-day waiting period from infection to the next booster for COVID. What do you recommend?
No, if you know you're over the acute infection, if you've been recently infected, don't rely on that infection that you had to provide you with the level of immunity that you need moving forward. But really, you just need to be over the acute infection and no longer symptomatic to go ahead and get that bivalent booster.
From Stephanie Douglas at WMC TV, where are the transfers happening the most? She'd like us to name hospitals. And she said, sorry if I missed it, but what are the current flu hospitalization numbers? Twofold there.
So I can talk a little bit about the transfer locations, and they're where you would normally see transfers from some of our rural hospitals coming into the regional facilities, Tupelo Market, the areas around Hattiesburg, on the Gulf Coast, and of course here up in Jackson and up around DeSoto County in the Memphis market. It's where a bulk of our transfers are made from around the state into those particular markets. As far as the flu numbers, I think, do we have those up on the chart? Maybe we can share the chart.
I don't know that they were on the chart that was shared, but you know, we've been watching our flu admissions as well. They are starting to trend down, but they're still at high levels. So we're still having lots of folks go to the hospital, go to the emergency department, go to their doctor for flu. Flu numbers have improved, but we're still seeing a lot of flu being transmitted out there.
Which I would anticipate we're going to be looking at these high numbers through Christmas and New Year's as we have the last 2 years.
I think for the next few weeks, we'll be dealing with them. And I only anticipate the COVID numbers to increase from this point.
Okay.
I think the transfer pressures will probably also remain. You know, and while we're talking flu and COVID, remember that many of the facilities that are these level 1 and level 2 facilities are also our trauma centers. So being very safe out on the highway when there's a number of people out there this year is going to be very, very important.
Also from Stephanie, when did Tennessee stop taking Mississippi referrals? How many referrals on a daily basis are waiting to be transferred?
Again, it's a dynamic system. It's hard to know what the exact numbers are at any particular point in time. At noon today's noon's report for trying to place transfers that were booked for today was as of noon that some of the Tennessee facilities were not accepting the transfers. So that could change in a matter of hours as people are discharged from hospitals and beds become available. But that was the current status at noon.
And I wouldn't look at it, it's not them saying they're not going to take our referrals, it's they're not able to take referrals, which eliminates a referral source for Mississippi. So it just makes the ability to transfer to higher level of care that much more difficult.
Courtney Ann Jackson from WLBT says, have we in Mississippi noticed the shortage of antivirals for flu as we've heard about in other parts of the country?
Yeah, we've heard about that in other parts of the country. I haven't been aware of any shortages of Tamiflu. Certainly Dr. Edney is plugged in with the medical community as well. No, I have not heard or been made aware of any of that.
Brandon Raines from WJTV. How large of a current concern is RSV in Mississippi? Does it compare to current flu and COVID numbers?
RSV is actually trending down in the southeastern United States. You know, we had somewhat of an increase of RSV earlier in the year that really coincided with the first increases of influenza that we saw. And you know, the RSV and all of this is kind of occurring at the same time. And when you start seeing those increased numbers of anything that are overlapping, certainly that can increase the pressure. But the RSV numbers are really moving down in Mississippi, and that's encouraging. And we've seen that in the Southeast as well.
Also from Brandon, you said flu numbers started going up earlier than usual. Is pandemic fatigue to blame, or what are some other possible reasons?
Well, don't we all have pandemic fatigue, right? But no, that doesn't have anything to do really with the occurrence of wind flu and when we see peak flu activity. Flu seasons are variable. They're very difficult to predict. We've seen seasons where activity can increase early. We've seen seasons where it's biphasic, where you see more than one or you see two peaks. We've seen seasons that don't peak well into March. And so there's a good bit of variability with flu seasons. And we have had influenza that has occurred very early like this before. And you know, our flu numbers now are high. They may go down. We may see an increase as we get more into the colder months. It's just very difficult to predict moving forward.
Kobe Vance at MPB asks, when should someone go to the hospital if they believe that they have or are confirmed to have the flu or COVID?
Really, if you start having severe problems, if you start having chest pain, if you start having shortness of breath, those are indicators that you may be having a more severe infection that requires a higher level of care. What we'd really like is for you not to wait to that before you go. Especially if you're high risk, if you have underlying medical problems that lead you to a higher risk of having complications from COVID. First and foremost, it starts with the vaccine. But if you're ill, talk to your provider, get tested. If you test positive, especially if you're higher risk, talk to your doctor about getting treatment. That's going to be the best way, and start that early. You really need to start that medications, especially like Paxlovid, within the first few days of illness. So don't wait. Don't sit on it until you're sick enough that you have to go to the hospital.
We have a question from Becky Gillette at the Business Journal. Can you discuss the impact on healthcare worker shortages? Anyone want to take that?
Well, it's ongoing. We've dealt with it throughout the pandemic, and even as we have looked at better months with capacity. We've been so limited by staffing shortages. When you look at the number of hospital beds and ICU beds that are available, if we had the staffing, we would have no shortage at all. In fact, we should not be in a shortage crisis right now, but we just don't have the staff to run those beds and to open them. So until staffing equilibrates either from staff coming home from being travel staff in other states, or as we are able to graduate more healthcare professionals into the workforce, we're going to be dealing with this. And this is one of the unique strains on hospitals, is the increased overhead for staffing and the availability of staffing.
I don't see any more questions. So would y'all like to do a quick round robin of final thoughts? Anything that you'd like to urge? Jim, would you like to start?
So sure. Again, hoping that everyone has a very, very happy holiday season. But remember, if you are symptomatic and you believe that you may have COVID, by all means, get tested. And if you need testing, home tests are available at our county health departments. So please take advantage of it.
Dr. Edney?
Yeah, and thank y'all so much for helping us today to convey the message to the public that we serve of, how they can protect themselves and their families and take the strain and stress off our hospital system. We are grateful for the partnerships that we have with our media partners, with our community partners, and we're very grateful to be able to have the great relationship we do with the 2.9 Mississippians that we serve each and every day. So we want you to have a safe, happy, and healthy Christmas holidays, and know that we're here for you as we're needed.
I ditto everything that they just said, but no, this is a situation that we find ourselves in that is very familiar in the fact that we've talked about at the very beginning, as we've moved through these successive waves of, we're about to have another. And we've talked about this kind of off and on for the last several years. There's a lot of encouraging things that we've seen with our last couple of very large surges that we've had of COVID. And that's been due to the fact that we've had smaller proportion of deaths. And that's an encouraging piece that we want to continue that trend moving forward. And the best way to do that is to make sure that yourself and your loved ones are up to date with your vaccination. We've had these tools available now. They've continued to evolve. They're going to continue to evolve. We're going to see some changes and modifications with COVID vaccines moving forward. And there may be times when additional boosters are recommended in the future, but let's keep doing our part. We've done so good these last few times in protecting our most vulnerable population. Let's go ahead and do it again. Let's do it one more time, get ourselves through the holidays, get ourselves through this next surge with the least amount of impact.
Dr. Sutton?
One more time sounds good.
One more time.
One more time.
Yeah. And I would just to echo everything and would just add that community engagement is a key piece to this. We have a good, safe booster that's available right now at this time. So we need to take advantage of that. And we need to do it with partners. And we are looking for partners to help move the vaccine and provide a booster shot all over the state. And we've done it before and we can do it again. And so I want to just encourage to reach out to us and let's form those partnerships. Let's revitalize those partnerships and let's address this issue.
Thank you very much. We had one last question from Courtney Ann Jackson, and I think y'all have covered this, but just to reemphasize, it takes some time for the flu vaccine to become fully effective. So since Christmas is approaching, how important is it that people get their shots now?
ASAP. It takes a couple of weeks to be fully protected. So let's don't wait. What is it, 18 days till Christmas or something like that? So you got a little bit of time. Let's do it now.
And we have our second peak in the spring.
That's right.
Seeing no more questions, thank you all for joining us today. Thank you, gentlemen, for sharing this information, and y'all have a great afternoon.
Thank you.